Hi, welcome back. Rohrich Knows, helping you become a better and more informed you. Full face Botox. What is it and why do I prefer it as my preferred way of doing neuromodulators of the face? I call it the RJR full face Botox. The reason I do it is because it's a great way to shape the face. And I've done this on several different podcast YouTube channels. Just make sure you tune in to Rohrich Knows podcast and my YouTube channel. And the biggest reason I do full face Botox or a neuromodulator is that it individualizes treatment of the face, of the upper, middle, and lower face. And it gives it a natural look. That's why it doesn't look like, oh my God, you had Botox. And I can see that sometimes, especially in political arenas when people are debating and the eyebrow keeps popping up. I mean, that's really not a good look. And it's a comprehensive full face treatment. That's the most important thing. And it looks natural, not overdone or frozen. So you want to be able to animate. And with neuromodulators, it's minimal to no downtime, an hour. You can be back doing everything. So what's the reason for it? It's comprehensive, non-surgical neuromodulation, facial rejuvenation. You're targeting each area of the face, the forehead, the eyes, the cheeks, and you'll see. I'll show you a video of how it's done. It gives you a natural looking result, not a frozen look, and it maintains the facial dynamics, but softening the wrinkles and the lines, and I think those are very good. And obviously it prevents the formation of new wrinkles, especially if you're doing it time and time again. It relaxes those facial muscles. Minimal downtime, and above all, it customizes. I mean, patients fly in to see me because they've had Botox done at their where they live, because it's not quite the same. It's truly an anatomic lesson on looking at that patient's face. There's a big eye and a small eye, and how you modulate it to make them more symmetrical. That's the beauty of full face Botox. So I'm going to run through this beautiful patient that had neuromodulation, starting at the forehead to the nasalis, to the crow's feet, to the lips, and the platysma. So let's just do this. So basically, the most important part is to start in the glabellar area. You ask them to frown, and then there are 3 to 5 points in that area, and they're very specific. In this patient, because she's got the 11s, you put 5 points, and you're putting into the deep muscle, not the frontalis. It's the corrugator muscle, so you don't get any ptosis of the medial eyebrow. And then you look at the left eye and the right eye, and you can actually balance that side because you're looking at one side, and one side's higher than the other. So you have to come down lower on one side. And I'm doing microtox in the upper face, and that's multiple little microtox in the area because that's the area that softens that wrinkle. And the upper third of the frontalis doesn't affect the brows. The nasalis is next, the bunny lines. The mentalis is done here deep, and then I come up and I do microtox for the Puda orange in this area. Then I do the DAOs, which is the muscle that helps to turn up the side of the lips. And then, of course, I go and do the platysmal bands, 3 to 5 units every centimeter in that area, and that really, really softens that and gives you that nice natural neck look that you want. And then you have the Nefertiti look, where you're actually just weakening the platysma above and below the mandibular border, doing microtox in that area, and it really helps to shape that contour in that area and gives you that finesse jawline look, all done with a neuromodulator. It's fantastic. And then what you'll do is you go and look at the eyes. You know, and her eyes are asymmetric. The left eye is smaller than the right eye. So I'm going to come more medial in that area, and I'm going to get the crow's feet in that area. And these are done very superficially. The orbicularis is very, very much almost below the skin in that area. So you're going to do it putting in 2 or 3 units in that area, a total of 10 to 12 units. Then you do a double parallel row when the patient has a really significant right edge. We call that a double parallel or a double track in that area, and you do that bilaterally. You can see it takes 7 to 10 days to see that result. You see she's got a full crow's feet, staying very superficial, so you actually can also soften the eyelid area in that area. That's that little crow's feet. And you're doing it very superficial in that area. It's almost microtox. Then you're going deeper, and then you're coming up just below the brow. But you're doing further out because this is the big eye. So you want to go further in on the small eye and further out on the big eye. And then that's it. That's your facial area. And then, of course, I'm doing a little microtox for the fine rhytids in this area because that'll help soften these fine little rhytids in this area. And that's certainly a finesse move that you shouldn't probably do unless you've really done a lot of them, because that really helps to just soften those fine rhytids in the dermal matrix in that area. And so that really encompasses the entire area of the face, and it really gives you the shape and contour you want. And then, of course, we'll end up with the lip flip, and then you're really injecting 1 or 2 units in each side of the upper lip to help flip the upper lip orbicularis and give you a nice soft look in the lips. And that really is a beautiful little finesse procedure that you will really gives them a nice pucker and done naturally. So here's a patient that had that pre-op, post-op Botox, shaping and contouring. She's also had some lip filler, but primarily had some neuromodulator to help bring her size of her lips up and bring her eyebrows up, give her more shaping and contouring in that area. And it looks beautiful, and it lasts 3 to 4 months. And you also can do it in patients like this lady that had a face and neck lift 12 months ago, and then I did a neuromodulator about 6 weeks ago, and you can see it really enhanced her brow shape and arch and shape and contour, gave her a nicer shape and look into her eyelids and lower face. And these are all things that supplement the beauty of a patient, whether she's had augmentation or she's had a facial rejuvenation. So I think that full face Botox, RJR style, is very much customized to give you a comprehensive full face treatment, a natural look, not an overdone look, minimal to no downtime, know before you go, and give me your thoughts, give me your comments. It's really a signature thing that I do every day, multiple times. Thank you for staying tuned to Rohrich Knows podcast. Give me your comments and DM me on any of my social media network. Till next time, stay safe.